Comparing Plan G, Plan N, and the other letter plans. Hi, I'm Thomas Smith, founder and lead healthcare agent of It's That Time. Plan G, Plan F, Plan N. Medigap Supplement letter plans are standardized by Medicare. In all, there are 10 different letter plans, some of which are not even available in most states. Some of the letter plans, such as Plan G, are everywhere, like Toyotas. Others are like Peugeots, basically not worth talking about. Plan F used to be the most popular, but as of 2020, it was discontinued other than for people who turned 65 prior to 2020. Because everyone who has Plan F is now at least 71 years old and aging, the premium costs of Plan F have skyrocketed and will continue to go up more as the pools age further. I recommend for those on Plan F, if you can pass underwriting and get out, to make the switch over to Plan G. Plan F covers both the Part A and Part B deductibles 100%, so you have no deductible or any other copayment costs. Plan G, which is by far the most popular plan, covers the Part A deductible, but not the Part B deductible, which is set by the government each year. This year, in 2026, the Part B deductible is $283. So that is your only deductible expenses for the year. Around 80% of people with Medigap supplements have either Plan F, if they have been on Medicare for a while, or Plan G, if they are more recent. The other two plans we will discuss is Plan N, which is the second most popular plan, although Plan G is more popular than Plan N by 4 to 1. We will also discuss a hybrid of Plan G called a High Deductible Plan G, though I do not recommend what we call High G. Letter plans are standardized by the government, so a carrier cannot decide, let's make our deductible half price, only $141 as a bargain. Or for each Plan G we sell, we will give away a free Plan G to somebody needy. It would be nice, but it's not allowed. With a Plan G Medigap supplement, between what Medicare contributes and what your supplement contributes, 100% of your Part A hospital costs and 100% of your Part B doctor and other medical costs are covered. But you do pay the first $283 as a deductible yourself. If all your medical expenses in a year are preventative, you wouldn't even pay the $283 deductible, as there is no deductible charge for preventative health. Plan G also picks up the 15% excess costs that some medical facilities and doctors can charge, often referred to as balance billing. In 8 states, there is no balance billing, as state law prohibits it. To better understand excess charges, some medical facilities do not accept what Medicare is willing to pay, called assignment. But they do accept Medicare patients with an extra fee of 15% above the Medicare payment amount. A well-known example is Mayo Clinic. Plan G picks up this excess charge amount, often giving people further peace of mind of knowing with their Medicare they can use the maximum number of facilities. Because Plan G gives you more benefits than Plan N does, the premiums will be around 20% more for Plan G than Plan N. Plan N, however, does not cover excess charges. The other big difference Plan N has is that with Plan N, you pay a $20 copayment for most doctor visits and $50 for emergency room visits. You do not with Plan G. High Deductible Plan G, or High G as we call it, has a substantially lower monthly premium. In fact, it's less than half the cost of regular Plan G. But there is a catch. Instead of paying a $283 deductible, you pay a much higher deductible with a High G. In 2026, it's $2,950 and is reset higher by Medicare each year. The reason I don't recommend High G is that you may, with good luck, save, for instance, $1,000 in premiums this year. But if you have any medical expenses to speak of, and it doesn't take much in medicine to be totaled to $2,950, then it will end up costing you 3 times more than you saved. Worse though, once you are in a high deductible Plan G, you can't change to regular Plan G unless you can pass underwriting. So you may end up saving $1,000 this year, and maybe even for a year or two. But as soon as you have any medical issues, you could end up paying triple that amount for 30 years to come. Some bargain that would be. Plan G provides you with the most flexibility and cost certainty. That's why it's so popular. Popularity tends to come with good reasons.